majored in nutritional science as an undergrad. I came here as a part of the pre-specialty program. In undergrad, I worked as a nurse's aide, so that kind of segued into like the nursing practice of how I got interested in coming to Vanderbilt in the nursing program here. I took a health science class in high school, and I liked healthcare, and I liked working with people and science, and I feel like nursing blends that science and that medicine. I wanted to become a nurse practitioner because I wanted the ability to be able to work with my patients at a deeper level. I can assess them, I can make decisions about their health with them in a team collaborative approach. The nurse practitioner role really gets to educate the patient and empower them to make healthcare changes. And I really love the elderly population, but I feel like the adult aspect and the Gero blended together give me a little more practice range. I was also interested in the accelerated aspect. Having a bachelor's degree, I didn't want to be in school, go to med school for a lot longer, so I was attracted to both the speed and the program. I think the biggest thing for me has been taking it week by week with all the homework and clinicals. It can get overwhelming, but our faculty has been good about saying, if you feel overwhelmed, like, contact us before we get into this snowball stage where you feel like I can't do this. All of the faculty that I've encountered in our specialty are so passionate about what they do, and I don't know how that couldn't motivate you to want to do the same thing. Keeping in mind that big picture wise, this is my dream, this is what I'd love to do. We're learning material that is up to date, that is pertinent to practice, that we know is evidence-based, which I think is great. So I'm really a hands-on learner. This program does a good job of, when we learn something in class, in the textbook or lecture, we usually follow it with lab or clinical. They pair well together. When you're interacting with patients or interacting with your classmates, you really learn from each other in a way that is different than most programs, because our class is very diverse in age and where we are from and past careers, which I have really enjoyed. I'm not opposed to getting my DNP someday or teaching, so those may be on the horizon, but initially I'd like to practice for a few years before I get back into school again. If you're passionate about healthcare and people and medicine, then this is a great program and field to go into.